Hi, my name is Jasmine, and I'm a graduate student with Dr. Cynthia Guimond at the Royal. I have the privilege of presenting one of our studies that developed a virtual reality cognitive remediation program. Psychotic disorders are characterized by neurocognitive and social cognitive impairments, which directly lead to community functioning challenges. Cognitive remediation is a psychosocial intervention that can improve these two cognitive domains. However, there is limited transfer of the knowledge and skills gained from the intervention to functional outcomes. One way to address this limitation is to deliver cognitive remediation in virtual reality, as it allows for training in more ecologically valid environments. To date, there are only a few virtual reality programs for people living with psychotic disorders, and some of them feature exercises that are not situated in naturalistic scenarios. Additionally, there are limited cognitive remediation programs that were developed with user groups like people with lived experience and healthcare professionals. The objective of the study was to determine the treatment needs of people with lived experience. We call this group our content experts and healthcare professionals. We also co-developed a virtual reality cognitive remediation program. To develop the program, a qualitative research study involving a series of focus groups was conducted between December 2020 to March 2023. 11 content experts were enrolled, and there was almost an equal distribution of schizophrenia and schizoaffective disorder diagnoses. On average, participants were 43 years old, and 73% identified as male. 7 healthcare professionals were enrolled in the study. All healthcare professionals had at least 2 years of direct experience supporting this population. Our healthcare professionals came from a diverse range of backgrounds, including clinical psychology, neuropsychology, occupational therapy, and psychiatry. In the first 4 content expert groups and the first healthcare professional group, participants shared their personal lived experiences or professional opinions on the challenges associated with psychotic disorders. In the remaining groups, participants watched videos of the virtual reality program and provided feedback. After each focus group, we integrated the feedback provided into the virtual reality program, and at the next focus group, participants viewed the updated virtual reality program videos. To ensure that the program met the needs of our 2 user groups, we conducted 2 separate thematic analyses. Our content experts analysis revealed 4 distinct themes. First, participants discussed areas they would like a program to target, such as general social cognition and memory. The second theme was that content experts highlighted various program design elements, such as the importance of a program in being immersive and interactive. For the third theme, content experts emphasized that there should be more technology integration into interventions to increase its efficacy and accessibility. The final theme was that content experts disclosed feeling isolated and various negative experiences such as stigma. They emphasized how programs should help them with their community integration and building connections on an individual and group level. For our healthcare professionals, there were 3 themes that emerged. First, healthcare professionals discussed the importance of a program in addressing the research to practice gap. The second theme was that healthcare professionals brought up a lack of client engagement in services. They also emphasized different ways a program can help improve engagement, such as the ability to personalize a program to clients. The final theme was limited resources available in healthcare. Some of these limited resources that were brought up was a lack of staff availability and cost. Healthcare professionals also suggested ways a program could help address these limitations, such as when a participant is on a waiting list, they could practice using strategies in virtual reality, which will later be expanded on by occupational therapists. We developed a virtual reality program with content experts and healthcare professionals. This program features 3 environments where participants complete different tasks, learn cognitive remediation strategies from a coach that is actually integrated into the program, and practice using these strategies. Our results suggest that while content experts and healthcare professionals do have some overlap in treatment needs, such as the task targets and key design elements, they largely have distinct perspectives. Integrating these perspectives can provide a more targeted approach to cognitive rehabilitation and address the needs of these 2 user groups. Developing a virtual reality program may improve generalization and transference to community functioning. It can also potentially improve motivation and engagement. For example, integrating the virtual reality program into a clinical setting may make cognitive remediation more accessible for content experts and improve overall patient engagement in services. We are currently conducting a trial that is examining the initial feasibility, acceptability, and efficacy of this virtual reality program. This study was supported by the New Frontiers for Research Fund, and thank you for your time.